Good evening. To start off, I would like to thank all the participants in the webinar tonight. My name is Lisa Lau, and I will be presenting Raising Healthy and Safe Teens. Before we begin, I just have a couple of things I would like you all to know. Throughout this presentation, I encourage you to interact with me by typing in questions and comments using the question panel you see on the right-hand side of your screen. If you cannot visibly see your question pane, click the red arrow and expand your menu bar. I will be answering any questions you may have after the presentation. However, if you ask a question and I do not answer it at the end of the presentation, I will email you a response within 24 hours. I would also like to remind all of you that with recording today's webinar, and will make the recorded link available to you 48 hours after the presentation. So if you miss something, you will have the opportunity to go back and view the presentation. Raising healthy and safe teens. First, we're going to start out with a definition of teenager. A teenager is a term widely used to describe an age range between 13 to 19 years old. The teen years are a time of transition from a dependent child to a young adult capable of taking care of themselves. The teen years are one that is most difficult and confusing times in a person's life. The teenager tries to navigate issues such as social cliques, peer pressure, relationships, and schoolwork. In addition, teenagers have hormones that can make them go from happy to moody in less than 10 seconds. As difficult as being a teen is, those years can be just as challenging for a young person's parents. Pressures in teens. Today's teenagers are under a lot of stress and pressure. Some common concerns are school, academic, extracurricular activities, money, overscheduling, fitting in, peer pressure, family, parents, depression, dating, choices, drugs. Parents spend a lot of time teaching their kids right from wrong. They show them what they think is right and hope they keep their children from falling from negative peer pressure. Even though we work hard at raising our children to do what's right, they will still make mistakes along the way. But we can still help them learn to stay on track by utilizing some techniques to avoid peer pressure, and something that we can talk to our teens about. Parents, teens, and peer pressure. We can work on nurturing a strong self-esteem, help your child develop the skills to resist negative peer pressure, talk with your child about how to avoid undesirable situations or people who break rules, promote positive peer pressure, promote healthy relationships, remind your child that there is strength in numbers. When it comes to youth, alcohol, and other drugs, remind your child that they are the majority that do not experiment. Remember, parents, you are one of the biggest influences on your teens. It may seem like they aren't listening, but they truly are. When parents stay involved in their children's lives, their kids tend to make better choices for themselves. Many studies have backed this claim. As unbelievable as it seems at this point, stay interested and involved in what your teen is doing and continue to be aware of what he is up to. Be consistent with your message about your expectations. If you expect that he will not drink, smoke, or do drugs, or have sex, he is less likely to do so. It is as simple as that. Teaching your teen how to say no, different types of refusal and resistance skills. An important component is teaching your teen steps when they are asked to do something or go somewhere with their peers. It's very important that we work on role playing before the pressured situation comes up. Find out the details. If the situation involves alcohol use, equip your child to state the problem to their friend. Mention the consequences. Suggest an alternative activity. Nurture a strong self-esteem. Help them with good decision making before the pressured situation comes up. Teens naturally want to project the right image. However, you can reduce the influence that peer pressure has on your teenager by making some of these skills ahead of time. More helpful ways to say no: make a joke, give a reason why is it a bad idea, make an excuse, help them with saying no, ignore the suggestion, repeat yourself if necessary, leave the situation. The power and strength in numbers. Help your teen make healthy decisions before the pressured situation comes up. Sometimes teens need the language to help them stay away from risky situations. These are some different ideas on ways to say no. Communicating with your teen. Do you speak teen? Research shows that teens who learn from their parents about the dangers of underage drinking, drugs and abuse, dangerous driving, other risky behaviors are less likely to engage in them. Keep the lines of communication open. Ongoing communication. The better you communicate, the more at ease your teen will feel about discussing drugs and other sensitive subjects. Be clear with your child that you don't want them using drugs. Be specific when setting rules. Make sure your rules are clear and you say yes or no. Be a good listener. Listen non-judgmentally. Give honest answers. Use some of the information that you pull off, some of the current information from the news and reports. Use anti-drug commercials like Above the Influence. This is a very good website to visit for teens. Role play with your teen. Teach them, don't criticize. Remain involved. Continue to ask questions and encourage them. Don't make up what you don't know. Don't react in a way that will cut off further discussion or communication. When you role play with your teen, practice ways to refuse drugs in different situations. Acknowledge how tough these moments can be. Give more specifics on using role playing. Some helpful hints for keeping your teen drug free. Some of these things that parents can use: I will talk to my teen about drugs. I will set clear no drug rules. I will be more involved. I will ask the right questions. I will stay on top of emerging drug threats and issues. What our research says: 2/3 of kids say that losing their parents' respect and pride is one of the main reasons they don't smoke marijuana or use other drugs. Teens who learn the anti-drug messages at home are 50% less likely to use drugs with their friends or in the community. Teens with a hands-off parent are at 4 times a greater risk of smoking, drinking, and using illegal drugs as teens with hands-on parents. Parents, it's important that you stay involved with your teenager. Helping your teen steer clear of drugs. Make sure you set clear boundaries and rules. Make sure that they know that you're not going to tolerate any drinking until the age of 21. Help them learn respect for their body and mind. If they find themselves in a dangerous situation where alcohol is, have them contact you or a family member that you have agreed is part of a safety net plan. So for instance, in a situation to help your teen save face, maybe you have a safety message like, I have a headache, and you know exactly that they're in a bad situation or a risky situation. So you need to come and get them immediately. Or if they cannot get a hold of you, have another family member in that safety net plan. Make sure they know never get into a car with someone who has been drinking or using drugs. Make sure it's clear that they know they can contact you at any time, and make sure that their situation is safe. If they are out after curfew, contact you and tell them why. Make sure they're not hanging out with friends when the parents are not home, unless it's agreed upon in advance. No spending the night at someone else's home if there's no parental supervision. Those are good key things to steer clear of drugs. Helping your teen create a safety plan. It's important to explain, relate, and educate. Let your teens know that they are the most important person and you want them safe. And it's okay, parents, to ask questions. Ask a lot of questions. I always tell the teens that if we ask questions, we want their safety to be number one. What happens if your teen needs advice fast and you are not available? Come up with a network of trusted people that they may call and go over the plan ahead of time. Remember, alcohol is the number one drug choice of teens. Parents matter in a teen's life. Help identify important events. Help promote the communication. Make sure there's healthy, good communication, two-way communication. Pick your battles. Make sure you always use the golden rule. Respect others the way that you want to be treated. Be open to your teens' questions. Make sure you encourage healthy growth and opportunities. Make sure that you remain positive as much as possible. Encourage your teen to be involved in activities at school, in the community. Be an active participant in your teen's life. Be a parent and set clear rules. Build strong boundaries. You are the greatest role model and example for your teenager. Like and respect yourself. Don't allow any other person to mistreat you. Don't be afraid to ask where they are going, who will be there, who's going to pick them up, what time they need to be home, those types of questions. Allow decision making. Sometimes teens make snap judgments based on impulse, especially when situations come up quickly, leaving your teen with little time to sort out the pros and cons. Remember, teens' brains are still growing and developing, and they're very impulsive at their age. Some hasty decisions that teens make may involve cheating in school, skipping classes, using alcohol, tobacco, and other illegal drugs, going somewhere or being with someone that you do not approve of, or driving too fast for conditions. The consequences can include losing your trust, letting down friends, getting into trouble, hurting education and job prospects, causing illness or injury, or leading to other reckless behavior. Make sure that you use examples in teachable moments. Talk about things. Talk about today. Talk about how school was. Talk about the news, ads. Share an experience that you had today. The best place to begin guiding children and teens in making choices about drugs is in the home. Make sure that you encourage teens to make decisions based on their values that you have taught them at an early age. They come across many tempting choices. The first step a teen can take toward good decisions is to know themselves. When teens are unsure of themselves, they are more likely to give in to social pressures. When a teen feels good and has good, healthy self-esteem, it improves the odds that he will make good decisions for him or herself. Parents can build teen self-confidence by teaching them to think for themselves. Ask your teen for their opinion, even about small issues. Urge him to make decisions, praise him for positive choices, and let him know that you appreciate him and her achievements. Expose them to activities, people, and places, ideas. Doing so will broaden his or her outlook and help to limit the influence of peers. The likely result is a teen who doesn't worry about what others say, thinks things through, and chooses wisely. Teach them good decision making. Where to start? It's important that a teen knows themselves. You communicate frequently with your teen. You ensure no drug use, no alcohol use. You enforce family rules. You encourage them to make healthy choices. Have a good support system, which includes good friends and family members. Make sure that they have good community connections. And a lot of teens today participate in community service activities and are very connected with their community. Talking to your preteen, your 7th grader and freshman, teens need your support, your involvement, and your guidance. Unfortunately, at this age, many teens try drugs for the first time. Could be alcohol, could be other types of drugs. Talk about perceptions versus facts. The perceptions or friends' opinions might not be truly the facts. Take advantage how teens care about appearances, and discuss the long-term effects of usage. talking to sophomores, seniors, high school students, give more than a general message. Do not use drugs. Elaborate on that message. Make sure that you have factual information and can have a conversation and communicate this to your teenager. Discuss the effects of combining drugs and alcohol. Discuss consequences. What can happen if they choose to use and make a poor decision for themselves. Make sure they know the consequences of their actions and what can happen to other people in this situation. Praise and encourage teens for all they do well, and praise them for good choices and decision making. Some tips for parents. Love your teen unconditionally. Be a good role model. Make sure that if you are in a situation that you are drinking responsibly and that you are being a responsible adult that can still continue to drive them home. Build up your teen self-esteem. Encourage them to participate in activities. Encourage them to participate in extracurricular sports. These are all good things to help with self-esteem. Encourage them to join clubs and be with their peers. Teach your teen values such as honesty and responsibility. Encourage good communication and decision making. Again, back to those refusal and resistance skills. Help teach your teen to say confidently no. Make sure that they know that they can use you, an adult, as a refusal skill. Oh, my mom would not approve of that, or that would get me in trouble at home. I would get grounded for that because of the rules that you establish with your teen. Teach your teen to manage stress in healthy ways. Your teen is under a lot of stress. They have many commitments. They are going in many different directions these days. So make sure that they have healthy outlets. Encourage them to deal with their stress. Talk to someone about their stress. Do an activity, exercise, take a walk. All different healthy ways of dealing with stress, because we know when we don't manage our stress in a healthy way, that can also lead to poor choices, poor decision making, and possibly turning to drugs and alcohol. Educate yourself and give your teen straight facts. Make sure that you are educated on what's going on out there in your community, and you know what's going on in the drug culture, so you can present these facts to your child. It's a critical time to start talking to your teenager at an early age, because when it's critical that parents start talking with their kids when they are young about the harms of underage drinking and also using drugs, because alcohol is the #1 drug problem among youth. About 1 in 3 8th graders and half of 11th graders consumed alcohol in the past month, according to a study. And too many teens who drink aren't just having a cocktail at the end of the day. They are drinking a lot in one sitting, which means they are taking part in binge drinking. Alcohol is a major cause of death among young people. The part of the brain that controls planning, delayed gratification, and judgment develops last. This is why alcohol is a huge problem among teens. We are also concerned about underage drinking that is on the rise at such a big level in the United States. It is important to emphasize that underage drinking is not an inevitable rite of passage, and that statistics show there are a lot of teens that are choosing not to drink. What is a drug? A drug is a chemical substance other than food or water that changes how a person thinks and feels. Some commonly abused drugs among teens, we call them our gateway drugs. One is nicotine, another is alcohol, one is marijuana, and the last one is inhalants. These are our 4 gateway drugs. These are the first drugs that teens start abusing first, which also can lead to other harder core drugs, such as the use of heroin, cocaine, methamphetamines. How to tell if your teen is using drugs? You might look for changes in friends, their grades dropping, messy appearance, lack of caring about themselves, poor hygiene, red flushed cheeks or face, increased secrecy about possessions or activities, changes in conversations with friends, changes in clothing, increase in borrowing money, or you notice things are missing at home, missing prescription drugs, sudden change in mood, curfew changes, violations. Maybe your teen has always been home on time and they're pushing the limits a little bit. Lack of motivation, sudden change in appetite, change in their behavior or mood, and breaking house rules. They also may exhibit some changes in relationship with family members. Maybe they were very close with their communication and they've shut down or became more withdrawn from family and friends. Sometimes they might have slurred speech or may not be able to talk intelligently. Truant from school. A loss of interest. Maybe they were interested, they were a good basketball player at some time, and they've lost interest in that sport or lost interest in activities at school. These are some signs. What parents can do. Again, educate yourself, be knowledgeable about what's going on in the community about drugs and alcohol. Start talking about rules and consequences of alcohol and drug use, what can happen, what physical damage can happen to the person. Have open and ongoing communication with your teen about drugs and alcohol. Some alcohol facts. Remember, alcohol is a depressant. It, again, as I say it, is the most abused drug among teens. The average age the first person drinks is 12 and a half. Underage drinking accounts for 1/5 of the nation's alcohol consumption. Remember, teens are also faced with a lot of ads and advertising, and the more alcohol advertising a teen sees, there is the more likelihood that they would choose to drink at an early age. Also, one of the facts that I have read is that a teenager before the legal age of 21 will see about 100,000 messages that has to do with alcohol. Scientific evidence suggests that even modest alcohol consumption in late childhood and adolescence can result in permanent brain damage. Girls 12 to 16 years old who currently drink are 4 times more likely than their non-drinker peers to suffer from depression. Research also shows that teen drinkers score worse than non-drinker peers on vocabulary, visual, spatial, and memory tests, and are more likely to perform poorly in school as a whole. Also, some scientific evidence is that the teenage brain, they compared the teenage brain at age 15, a drinker to a non-drinking 15-year-old teen, and the drinker's brain also is smaller. Some short-term risks of alcohol use: poor concentration, hard to think, bad decision-making, blurred vision, poor coordination, alcohol poisoning. Many teens are rushed to the emergency room for alcohol poisoning. Also, it is a huge issue with teenagers. Bad breath and behavior changes. Some long-term effects of alcohol use: lowers the immune system. They can get cancers of the mouth and throat, cirrhosis of the liver, stomach ulcers, cancer of the pancreas, brain damage, weakens heart muscles, kidney failure, weakens bones, high blood pressure, bad teeth, and weight gain. Some consequences you might review with your teenager is unwanted sex, pregnancy, involvement with crime, blackouts, coma, or even death. Depression, low self-esteem. There's a lot of research that shows alcohol and suicide are very parallel. Accidents such as car crashes, drowning, falling. Some signs of alcohol use: slurred speech, very unsteady gait, sometimes they're loud and obnoxious, flushed face, smell of alcohol in the breath, decreased reasoning, poor judgment, and personality changes. Inhalants, another gateway drug that we need to be aware of, are common household products that teens are abusing for a quick high. They use them through huffing, bagging, sniffing, and dusting are the terms in inhalant use. Inhalants are breathable chemicals that are psychoactive, which are mind-altering the central nervous system. Some different types of inhalant products are glue, paint thinners, degreasers, dry cleaning fluid, dust off, gasoline, whiteout, Sharpie or permanent markers, nail polish remover, spray paint, cooking spray, hairspray, whipping cream, deodorant, fabric spray. These are all different types of inhalants. Obviously, if they're used for their intended purpose, they are fine. If they're used for the purpose of getting high, this is illegal for the teenager and adults. Some health risks from using inhalants can be slurred speech, dizziness, nausea and vomiting, loss of coordination, bone and muscle issues, and muscle spasms. Some continued health risks: memory loss, hearing loss, fatty tissue deteriorates. It can cause hallucinations, learning disabilities, personality changes. It can cause seizures or for a person to shake uncontrollably, hand and foot numbness, and arm and leg spasms. It affects every organ, every part of their body. It causes irregular heartbeat, liver damage, bowel problems, and also can be a fatal condition called sudden sniffing death, suffocation, frozen throat, respiratory arrest, choking, injuries. Here are some of the signs of use. Unusual breath odor, chemical odor on clothes. They can have slurred speech, appear dizzy, red, runny eyes and nose, signs of paint or other products on face or clothes, spots or sores around the mouth, constantly smelling their clothing. Chronic use of inhalants can cause anxiety, irritability, and restlessness. Prescription drugs. Prescription drugs could be a fifth gateway drug. Prescription drug abuse is on the rise among teens. It has had a lot of press lately regarding the abuse of prescription drugs, painkillers, OxyContin, Vicodin, codeine, morphine, Valium, Xanax, also the ADHD medications such as Ritalin and Dexedrine. Over-the-counter medications that could be abused are cold medicines, diet pills, steroids, cough medicine, pharmaceuticals, the illegal use of pharmaceuticals. Some teens take part in what is called farm parties. These are bring your own pills. They are passed around in a community bowl. They don't know what medications that they are taking, what prescription pills. They just take pills. They might take them with alcohol, and they are rushed to the emergency rooms, and ER doctors do not know how to treat them because they do not know what pills that they have overdosed on. So it's very difficult to know how to treat these patients when they come into the ER. Farming facts. They crush pills. The brain may not reach full capacity and maturity if they abuse these drugs. Prescription drugs can be more potent than street drugs. What can happen if teens abuse other people's prescription medications? Can increase their blood pressure. They can have difficulty breathing. It can cause organ damage, ulcers. They can become addicted to these pain medications or prescription drugs, cause seizures, and even death. Things to look for if you feel that your teen is abusing prescription drugs. Check websites that they may have recently visited. Check cough and cold prescription pills, check unidentifiable medications among their personal effects, in their jeans, in their purse, on their person. If you are having unexplained disappearance of medicines from the medicine cabinet, some of the signs that a teen might be abusing prescription medication: declining grades, again, loss in interest in hobbies, in usual activities, changes in friends, changes in their physical appearance, hygiene, and changes in their behavior. Sometimes they might experience different eating patterns and sleeping patterns. How to educate your teen on prescription drug safety. Educating ourselves and our teens about the potential dangers of prescription as well as over-the-counter drugs. Make sure you're safeguarding your medicine cabinets at home. This is a big part of helping young people stay safe and healthy. Here's some tips. Talk with your children about inappropriate use of prescription drugs and the dangers that can result from taking someone else's medications. Just as you would talk with them about the harms of underage drinking and other drug use. Young people may not always admit it to their mom or dad, but as a parent, you're the biggest influence in their life. The message you send about the harms of misusing prescription drugs is a powerful deterrent. Monitor your prescription drugs at home from the medicine cabinet, your master bathroom, the kitchen. Keep them in a secure place. Keep track of how many pills are in a bottle or a packet, and keep tabs on refills. The practice of monitoring prescription drugs and keeping them in a secure place is equally effective when it comes to alcohol in the home. Make sure that you look in your community for the correct disposal of prescription drug safety. Avoid putting medication down the toilet or drain. Watch for prescription drug take-back days in your community, and inquire about whether your community has free prescription drug boxes where unused or expired medication can be discarded. A lot of times in communities they have these drop boxes of medication and the take-back days. What does a drug problem look like? Again, change in appearance, lazy, lethargic, irritability, mood swings, secretive, withdrawing from friends and family. They may have trouble with the law. Change of friends and social activities. Some signs of dependency, denial that they have a problem. They get relief from drinking. Some mixed drug use. Some preoccupation with drugs. Secret drinking, blaming others, unpredictable behavior, broken promises with family and friends, maybe job loss or money problems, maybe loss of control. Make sure that you're keeping your teen active. As parents, we've all heard about the benefits to our children if they keep an active schedule, whether it's sports, music, science, the outdoors, or other interests. Busy kids have great opportunities to learn and grow, and they are less likely to get involved in risky behavior. Keeping kids engaged is important all through the year, especially during the summer months and after school hours of 3 to 6. Kids have a problem when they have unsupervised time. Make sure that you make a plan with them, what their interests are, what are their hobbies. Make sure they stay busy. The value of staying busy is effective regardless of whether an activity or a sport. Focus on supervised activities. Lots of kids love going to exercise or movies or doing something that with friends and family. With every headache, fear, unknown possibility, sleepless night, and error in judgment a teenager puts a parent through, teenagers can also be the greatest joy. It is a miracle to watch as the hard work from previous years unfolds into those moments of thoughtfulness, good judgment, kindness, earnesty, honesty, and humor. Teenagers are a joy when their world is in order. They are helpful and funny and offer parents a view of the world they could not otherwise know. Despite the anger and tension a teenager can inflict on a household, they also become the center of a household joy. Life is a roller coaster for a teenager and full of bumps, full of up and downs all the time, but the important thing that even if things get tough, we need to let them know they have your friends and family around you. Here are some resources. And thank you for participating in this webinar. This is brought to you by Health Directions. To learn more information or to schedule an appointment, call 1-800-288-5912, or you can email healthdirections@ncbhs.org. Or if you have questions about today's webinar, email communications@ncbhs.org. If you're interested in attending more webinars, please feel free to go to our website, www.healthdirectionsonline.org. And thank you.